I have performed the head and neck assessment, we're going to go ahead and move down to the respiratory, lung, chest area. So first I would inspect the patient for respiratory distress, any use of her accessory muscles, if she may be cyanotic, nasal flaring, tachypnea, anything like that. So I'll step around and look at the patient. She looks normal, fine, normal sounds. Then I'm going to inspect for obvious deformities and symmetry, and we don't see any of that. So we'll go ahead and move to the back and check for an equal chest expansion. I'm going to place my hands at the base of the lungs and ask the patient to take a deep breath. We have an equal chest expansion. After that, I'm going to go ahead and assess for tactile fremitus. What this will do is I'm going to use the ulnar side of my hand and ask the patient to say 99 as I move down the back to assess for symmetry of vibrations. So if you'll please say 99 as I move my hands down your back. Would you mind moving your hair for me? Ready? 99, 99, 99. All right. After that, we're going to go ahead and percuss over the lung fields. We are going from resonance to dullness. It would be flat if we came over any bony prominences or anything like that. Dullness is what we are ideally looking for. So I will use my second finger and use my other hand as we move down the intercostal spaces. Okay. After that, we're going to go ahead and move to auscultation of the lungs. We're assessing for bronchi, wheezes, crackles, pleural friction rubs, anything like that. So I'm going to go ahead and use my stethoscope and listen. Take a deep breath for me. And then we're going to perform two more tests, also with the stethoscope. Egophony, which I will ask the patient to say the phrase E as I listen. If I hear an A sound, then we would expect that there is some secretions or hyperresonance. And then after that, we will move to the whisper pectoral test. So once again, I'm using my stethoscope. Would you please say the letter E when my stethoscope moves? E. E, 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 E. So that was some normal sounds, nothing abnormal, everything was good. And then we'll move to whisper pectriloquy. This one I'm going to ask the patient to whisper 1, 2, 3. We want to make sure we don't hear anything at all when we do this. Will you whisper 1, 2, 3 as my stethoscope moves across your lung fields? And now I will assess the patient's anterior lung sounds. Using my stethoscope, once again, we are assessing for any crackles, bronchi, wheezes, anything like that. And this concludes the lung respiratory assessment.